Peace be to you all. Let's see, this is Omar Abdul-Malik, physician assistant and health educator. So I was asked to talk about the downsides of being a physician assistant. And I had to kind of think long and hard about this because, to me, there really aren't any downsides because it really fits my life very well in what I want to do. My priorities really are not my job or even my title. It's more about the type of person that I am and being the best, I guess I would say, servant of who I consider to be my creator, and being the best family man I can be. I'm far more concerned about being a good husband and good father to my 4 children than I am about being a clinician or a medical practitioner. So being a physician assistant really fits well with what I want to do. There is this kind of internal conflict, I would say, in the physician assistant field to fight for more autonomy, and we've gotten it due to the efforts of quite a number of people. We've gotten a lot more money. Like I said, when I first started as a PA, when I first got accepted to PA school, the average salary was like $56,000, and now it's roughly $100,000, give or take a few $1,000s. There are PAs who earn as little as $70,000, and there's PAs that earn as much as, from what I've heard, $200,000. You don't owe as much money as medical doctors do, but you don't have necessarily the prestige of being a physician. So if you say, well, I'm Dr. Omar Abdul-Malik, medical doctor, you're like, oh my God. It's different than if you say, well, I'm physician assistant Omar Abdul-Malik. You might not get that same response. If that's what you're into, then you'll be disappointed by being just a physician assistant, quote unquote. So if you're really into people being awed by your title, I would say go to medical school, if it means that much to you. In terms of autonomy, I wouldn't even say, gosh darn, I don't, this is a difficult question to answer, because what I've seen in the past several years, I've been a PA for 16 years, almost 17 years now. And what I've seen is so-called mid-level practitioners or advanced level practitioners, whatever we're calling ourselves now. So physician assistants, nurse practitioners. What I've seen is their autonomy increasing, and actually the autonomy of MDs and DOs decreasing, because now doctors they're coming out with so much medical school debt. They now have to, really be part of a group practice, or part of a hospitalist practice, or part of a private practice that's a group practice. And in that, you don't always get to do exactly what you want to do. Then you're also beholden to state regulatory boards like the Department of Health. I personally know doctors who've lost their licenses or have had their licenses suspended. That's a very difficult thing to go through, and then they've got to fight to get it back. Physician assistants can go through that also. I think the more autonomy we get, the bigger targets will be. So it's kind of, autonomy is a double-edged sword. As a PA, you don't have as much autonomy as you might like. I have tons of autonomy. I'd say I'd function with about 95% autonomy. My supervising physician is really amenable to me calling her. She's really great about answering any questions I have. On the same token, She,
Respiratory 5761. Respiratory 5761.
sorry.
Respiratory 5761.
Okay, all right. She doesn't want to be hovering over my shoulder. I mean, think about if you had an assistant or associate. Think about Batman and Robin. I like that. Or, if Batman had to like be over Robin's shoulder all the time, or if you're a Star Trek fan like I am, if Captain Kirk had to constantly tell Mr. Spock what to do, or McCoy or Sulu or somebody, you're no good as an assistant or an associate if the supervising physician's got to constantly be double checking your work and making sure they tell you what to do. So if it's so-called total autonomy that you want, you might be a bit disappointed if you become a PA because you don't have it. You have to, even if you get your own practice, maybe I'm considering that in the future to have my own practice. You still have to have a supervising physician. So you'd have to hire somebody to work in conjunction with you and be your supervising physician. Unlike if you're a medical doctor, you can just go out, hang your shingle up and say, well, I'm Dr. Joe, come to my clinic. Yeah, those days really aren't, I think we've seen the end of a lot of that. But if you really want like almost 99% autonomy, I would say, and you're a physician assistant, I'd say go out into the rural areas. We do have islands off the coast, off of Maine and Alaska. Practice in places where doctors don't want to practice, and then you can do like telemedicine. And you will have that autonomy that you seek if that's what you want. Another downside to being a PA is, I have to think, maybe the word assistant that goes along with prestige. There's a connotation with the word assistant that you're sitting around waiting to be told what to do, like you're an underling. Yale University has a physician associate program, and every once so often there's a big push to change the word assistant to associate, so we become a physician associates. But it doesn't really change our relationship with the supervising physician. I honestly can't think of a lot of downsides to being a PA. I really can't. So I would say prestige and then money, maybe. Like you're not going to make as much as a physician. So let's say an experienced physician assistant like myself might make, let's throw a number out there, let's say 130 a year. The doctor's going to make, more than twice that, 300,000 a year. But that doctor also owes $300,000 in compounding interest loans for medical school. If nobody paid for, I know a few doctors whose parents paid for medical school for them, or they did scholarships, like with the Health and Human Services. But there's very few. Most of the doctors I know that are under the age of 45 owe, at least $250,000 in student loans, minimal. I've heard upwards of $400,000. But I don't know, that's it. So just, you won't earn as much, and you may not have as much prestige, and you're certainly not going to have the same level of autonomy. But the money's still very good. I think most people can figure out a way to live off of, $100,000 a year. And you're not going to owe as much as the doctors. And you may have less accountability. Yeah, that's what I would say. The doctors have the ultimate accountability when it comes to things like patient care. My supervising physician, she's got to be the one that you meet with the CEOs and the CFOs and the CCOs and maybe disgruntled family members, and family meetings. I don't have to go through that, and the doctor who runs our practice, they got to figure out, how are you going to pay for overhead, people's benefits, and make payroll and things like that. So it becomes a business. And if you're interested in really getting into the business of medicine, then you could even go to nursing school and get a master's of health administration, and you can boss doctors around, get on medical boards, quality assurance and things. But the money, lack of prestige, or less prestige, and a little less autonomy. Those are the only three things I can think of that I would call the downsides to being a PA. I know that was a bit circuitous in my answer, but I hope my rambling kind of helps some of you all decide whether you want to become physician assistants or whether you want to become medical doctors. But please subscribe to my channel, and please leave your comments and questions in the comment section, and I will answer them as expeditiously as I can. Peace.